I'm moving in with Lucas.
It wasn't the tennis.
Was that Taub doing moving CPR on a patient after mounting the bed? This episode is wild. I guess Universal's intention is to see a day in the life of Wilson compared to the absolute chaos that is House's teams. Very excited to be reacting to House MD Season 6, Episode 10, Wilson. On this channel, we're reacting to all 177 House episodes, and this will be episode 121. Let's see if I can get the diagnosis before House does as a doctor working in London.
How about keeping down on the noise pollution?
6:33. You should be flossing by now.
I read somewhere that the Native Americans say turkeys know what you're thinking. We're terrible at this. Did you bring the bag? May 30th, 2004, 10:07 a.m. If treatment didn't go well, my leukemia would give me only 6 more months to live. I didn't die. Now move very, very far away from there so that I can be sure and thank you again next year. Thanks, Jim.
What the hell?
I can't move my arm. Am I having a stroke?
I don't know. Good news. Head CT doesn't show any signs of a stroke. I cannot believe how much you've grown up in 5 years.
Ashley, my girlfriend. New life, new adventures.
It's good to meet you.
So what do you think it is?
Wilson cannot catch a break. At home, he's got House's House of Rock, and when he's taken out to be thanked by a patient, he almost gets shot just before he shoots his shot at what turns out to be the man's girlfriend. Only Wilson could get it done in that order. But our patient's nerves need to get back in order if these annual shenanigans are to continue, so what could this be? Well, the patient did say new life, new adventures, so what if that includes more than just a new girlfriend? Maybe he's trying new drugs like mushrooms and ended up with a poisonous one, or he's been adventuring a bit too much and got himself herpes, which likes the look of his cranium. That's a bit simplistic for House, so what else could it be? Ooh, I have an absolutely crazy theory. Maybe he didn't have leukemia in the first place. They thought it was a blood cancer, but he actually had an autoimmune blood disorder like hemolytic anemia, which got better after he took the cancer drugs. We know that those drugs kill tumors, but can also suppress the immune system, so it isn't much of a stretch. The real questions are though, why were they hunting turkeys? Why was House playing his guitar? And will they find out the diagnosis? Let's get more clues.
Hopefully something innocuous. There's a doctor I can speak to who's great. Sorry, that cold sore, how long have you had that? That cold sore is caused by a virus. The virus could transfer, infect your spine, and cause the paralysis. I'll get you a room and start you on acyclovir. I just had a House moment. Diagnosed transverse myelitis from a cold sore.
The self-important jerk does not have transverse myelitis. He's got cancer. Your guy's low white count of right arm paralysis equals a recurrence of his leukemia.
No AML cells anywhere.
I look for zebras because other doctors rule out all the horses. In this case, you are those other doctors. Your caring is clouding your diagnosis.
Are you depressed?
I have cancer.
That's never stopped you from bragging about the grandkids. I don't want you to get alarmed, but sometimes depression can be a sign that something else is going on. What's going on?
It's his foot now.
It's nothing. I just started getting a little tingling feeling in my foot.
Could you give us a few minutes? It means the medicine I gave you is not working.
Are you sure that this isn't a recurrence?
Once you've had cancer, recurrence is your biggest fear. I get it. That's not what's happening here.
Can you call my daughter and ask her to come down?
Of course. I'd rather you regretted coming than regretted not coming. Thanks, Emily.
I'm moving in with Lucas.
It wasn't the tennis.
Was that Taub doing moving CPR on a patient after mounting the bed? This episode is wild. I guess Universal's intention is to see a day in the life of Wilson compared to the absolute chaos that is House's teams. You can see that by how casually Wilson and Cuddy are after seeing that scene, like it's as common as presidents arguing over their golf handicap. It's interesting that even though Wilson is basically House's only friend, he still can't just go to him to pick up his patient, as his case sounds too much like vanilla hooves. He wants those fluorescent chili, mind-melting, eye-watering, bowl-blasting Scotch bonnet hooves to at least make it onto his radar. That doesn't seem like the only difference though. Wilson seems much more focused on the emotional aspect of the job, picking up on the second patient's depression and ending up as friends with the patient. He still has some diagnostic aspects though, like maybe the depression in the second patient is a sign of cancer, that's moved to the brain. He also had that little house cold sore moment, but you wouldn't jump in and treat for that straight away, as I've seen the treatment acyclovir actually cause liver failure before. By house standards, in all fairness, going in blind with that is as dangerous as eating a 0-calorie ice cream, although an ice cream with calories is probably less dangerous. Now it seems our patient has some tingling in his foot as well as his inverted arm, so what could that be? It all seems to be nerve related, and when they affect random distinct areas like this, we call that mononeuritis multiplex. The most common causes of this in the real world are diabetes, autoimmune disorders like rheumatoid arthritis, or lupus, and blood vessel diseases like polyarteritis nodosa. Less common causes include things like amyloidosis, Lyme disease, leprosy, and granulomatosis with polyangiitis. My next steps with him would probably be doing nerve conduction studies, an MRI of his head, and checking his blood tests for markers of autoimmune diseases, calcium, and taking it from there. It sounds like House wants Wilson to do a bone marrow biopsy to really make sure it isn't blood cancer again, so I wonder how long he'll hold out with that. Question for you smart people, do you ever feel like you've been living in someone else's shadow and aren't noticed because of that person being around, like what House is doing to Wilson? What was your experience? Answers down below.
You're moving in with Lucas? Started smoking again? No.
I was at Mom's house when Dr. Wilson called.
Hey, are you okay?
Whatever's causing this is affecting more than his nerves. I need a crash cart in here. House and I have a bet about one of my patients. You guys mind making him $100 poorer? Left arm paralysis and trouble breathing.
Could be fungal.
If Aspergillus fungus balls took root in his lungs and spread to his spine, it would explain both. We do have to open you up. It is surgery.
You gotta do it.
The patient's ex-wife isn't even with him anymore, and she's still running the show. Maybe it's times like this, when things go really bad, that he sees who is actually in his corner. The young new girlfriend, Ashley, may have been fun in the highs, but may not have what it takes to stick out the lows. Of course, this isn't the case for every couple, but love how the creators of the show pull in so many different interesting themes to just one episode. All of that aside, we have a new clue: breathlessness. I mean, Wilson's disease can affect both the nerves and the lungs, and the episode is called Wilson, but that would be way too obvious, and the symptom onset more gradual. Oh, I have another theory. You may have noticed earlier that Wilson said, "Are you smoking again?" which indicates that he was actually smoking in the past. House also said that it's cancer, but all the blood tests he's done seem to show that cancer isn't back. Maybe Wilson has now ruled out the possibility of cancer because of that, but the patient actually has a separate cancer sitting right in his breathing bags. Small cell carcinoma of the lungs. These can even trigger a paraneoplastic syndrome called Lambert-Eaton myasthenic syndrome, which can cause arm weakness and potentially even some tingling. Treatment would be to cut out the cancer alongside chemo or radiotherapy, and the patient will be back to his new life before he can fall back in love with his ex-wife. Alright, small cell lung cancer with paraneoplastic syndrome has to be my first diagnostic guess. Let's get more clues.
Dr. Chase will be in here soon to get you set for the OR.
Just give me the $100 you owe me and I'm gone. Next time you want to use my team, I suggest you at least leave a tip.
I'm late for surgery. Why did you leave, Melissa?
We got married young. I'm not sure.
Wilson, he's got global lung damage. Means it's not fungal. It's PCP pneumonia.
HIV, acquired SCID, or my personal favorite, cancer.
If he's in remission, why did you bother scanning him?
During a routine follow-up, I realized the patient was depressed.
Your patient has cancer. Not that guy, who probably also has cancer.
You have acute lymphoblastic leukemia. It's a second leukemia. Tests show that the cancer is limited to your brain. That's good news. 90% chance of cure. We begin by surgically planting a shunt so we can get the drugs directly into your brain. I already booked the OR.
An oncologist missing cancer. That's like a mechanic accidentally filling your diesel engine with horse manure. Now, in all fairness, medical mistakes do happen to even the best doctors, but we have ways to mitigate them from our unreliable human processes. Our patient record system tells us when we're about to prescribe a drug that would be dangerous for a patient because their kidneys are failing, for example. We have a big red box at the front of paper drug charts with allergies that you can see on every page. Or a kind pharmacist will check our doses to make sure we haven't put the decimal place in the wrong place. Despite all of these safeguards, though, medical errors are, according to Macri and colleagues, the third leading cause of death in the US. Here are some examples of medication errors that happened from just one paper. A man with heart failure was given morphine instead of furosemide, which is a drug to offload water, because she was thinking of another patient. Another time, both a nurse and assistant nurse gave the same patient insulin because they didn't talk to each other. Another time, warfarin, a blood thinner, was temporarily held by the medical team, intended for a couple of days, but then was forgotten and not given for 2 weeks. Another time, a nursing student gave eardrops in the eyes of a patient because she misunderstood the supervising nurse's instructions. The list sadly goes on. But keep in mind though that it's the minority of cases that get publicized like this, and we don't hear about the millions of healthcare interactions per day that go smoothly because they're not story-worthy. We can see though how these would happen, which is why we have to be diligent as both healthcare providers and patients to make sure the right treatment. Yes, doctors should be safe and do their best, but it isn't a perfect world, so we can both play our part to help get closer to it. Now we know the patient has a type of cancer called ALL, so what is that? Well, Wilson said it was triggered by the chemotherapy, which is definitely possible as we know that chemotherapy can cause mutations that lead to too many white cells being produced. That's exactly what happens in ALL. But how can 90% of patients with a cancer end up being cleared? This is an important question because cancer survival of ALL has risen to that from 60% survival in the mid-70s. The biggest change was a new drug called imatinib. It's like a cellular switch that helps the immune cells replicating like bunnies switch back to their impotent panda states. It works for patients who previously had a particularly poor diagnosis because of a mutation called the Philadelphia chromosome, which has gone from death sentence to good news. So this patient does have pretty good odds, but is this really his final diagnosis? Let's get more clues.
If something goes wrong in surgery, someone needs to be appointed to make decisions for you.
I think maybe Melissa should be my proxy.
Revised OR schedule. Sorry, Wilson, had to bump you.
Your case is no more urgent than mine.
You're way more patient.
You trust her more than me.
About this, yes.
Melissa's been to hell and back with me. I love you. Don't make this into more than it is.
Can you feel this?
No.
How about here?
No.
Move your fingers. The chemo from your first round of treatment has made the leukemia resistant.
We just removed a screw from the guy's lung. The weird thing is he didn't get better. Doubling your patient's chemo dose is stupid.
Sounds pretty dangerous.
It is.
I think you should call Ashley.
You're my family. I'm sorry, I forgot that.
You should try whatever could keep you with us longer. Look.
I can move them. What is it, Jim?
Cancer's gone, but over half his hepatocytes are dead. He needs a new liver.
You can publish the results of this case study. No one will ever double the dose again.
If I don't find you a new liver, you've only got about 24 hours left.
Oh, it's like the mythical Hydra beast. Cut off one head and 2 more take its place. But the medical equivalent of burning the stump after cutting it off to stop them growing back is now a liver transplant. Now, of course, liver failure wouldn't actually kill you in 24 hours. In fact, it wouldn't even kill you in 24 days, as the average patient with end-stage liver failure lives around 1 to 3 years. Since I don't want to spoil what is incredible television though, what would be this patient's likelihood of finding a new liver match in 24 hours? If no direct family are a match, which would be his best bet, we know that around 35% of recipients wait less than 1 month in the US. Assuming that these were spread evenly across the days, which is unlikely, he would have a 1% chance of getting a match today. That's a lot higher than I would have expected in all fairness, but it does depend on his blood type though, as the rarer it is, the less likely he would be to get a match. Maybe I just predicted the next problem, but I bet Ashley, who has now been shut out, is going to be his only close match after she's just been unmatched in the Tinder of life. Let's get more clues.
Your father's been moved to the top of the transplant list. You and Emily don't match Tuck's blood type, and neither does Ashley.
Trauma came in. Motorcycle versus semi. Bad for the motorcycle, good for your liver. There's a problem. No organ donor card. Showtime.
I didn't speak to him for years. When my parents died, at their funeral, we made peace. If I allow you to defile his body, it will destroy that bond.
What if I told you he wasn't dead?
Then I'm not defiling a dead body.
House. It's too late. The liver started to degrade.
Religion just killed another person.
Would
have had 6 more months with them if you hadn't given me that extra chemo.
I'm sorry. We knew the risks.
5 years ago, when I needed a transfusion, you used your own blood.
Whoa, wait a minute. Wilson's a match. How did I not see that coming? Well done, Universal. Okay, let's think about this for a second. Wilson gives the patient his liver. He's out of work for 6 weeks, realistically, best case scenario. How many other patients now don't get care because he's gone? Is he really so easily replaceable that someone could swoop in and give the same level of care? That is something I struggle with, in all fairness, as there are over 50,000 family medicine doctors in the UK. So if I wasn't working, then someone else easily could be. For specialists though, it isn't so simple. Like, there are only 1,000 oncologists in the UK, 50 times less than the number of GPs. Either way though, where can Wilson draw the line? If he helps this patient, then what about all the others that he could have matched types with, who he didn't agree to donate his liver to? Where's the justice in that? Or what if Wilson actually died from the procedure? The potential impact then is just way more than just 6 weeks off for some wound recovery. Very interesting concept. Can't wait to see Wilson's response. I'd be grabbing popcorn right now, but I need to fit into a wedding suit my friend got me based on my measurements in January. So instead I'll settle for a crispy treat of gentle sarcasm and not so gentle storylines. Let's get into it.
We have the same type. You can give me a part of your liver.
I'm your doctor.
You're my friend. Fine, then. You're fired. Now you're just my friend.
I can't.
You're actually considering this?
I gave him too much chemo.
You cured his cancer. Bad things happen to people who are sick. Doesn't make you responsible. Don't be a doormat, Wilson.
You already think I'm a doormat. You're wrong. Clean up your stuff and get out.
That little dot could have killed me.
Fortunately, we caught it early.
You got all this off me not talking about my grandkids.
I want to donate a lobe of my liver to Tucker.
That's insane. You have hundreds of patients.
Why did you make me the head of oncology?
Not because you have the most organs. You're thoughtful, caring.
I have a friend who's about to die, and I have the opportunity to save his life.
Okay.
Call me a doormat, get it all out of your system, but I'm doing it.
All the pain pills I've taken, what if I need your liver? They're all dying. They're all your friends.
The operation is in 2 hours, and I'd like you to be there with me.
No, if you die, I'm alone.
Thanks, Jim.
How you feeling?
Can't complain, considering if it weren't for you, I'd be dead twice. The person you want when you're dying isn't the same as the person you want when you're living.
Hi, Jim.
I still feel good about what I did. Bonnie told me what Cuddy did. We do need a bigger refrigerator. She hurt my friend. She should be punished. Bonnie, I'll take it.
Wilson has lost a lobe of his liver, respect for his friend, but gained some claws in the process because we're about to have a turf war. I can't actually believe that he went through with it. Even for Wilson, that is a step too far on the guilt train. Seems like this baby is about to be decommissioned though, because there are only so many spare organs a living donor can give. A kidney here, part of the liver there, and 1 lung to top it off. What could be more wholesome? Poor choice of words. It seems like the patient didn't inherit Wilson's sense of ethics with his hepatocytes, as the patient decided to go back to his young new girlfriend after telling his family that he regrets forgetting who really has his back. Interesting episode and perspective, quite a departure from the usual format. Say 7.1 out of 10 entertainment. 3 out of 10 diagnosis, although that doesn't really seem like the primary purpose of this episode. 7.5 out of 10 accuracy. This episode makes way more sense when you watch the previous one where a mega genius chooses the simple life here.